3 people are dead aboard a cruise ship that no country wants to receive. Right now, the MV Hondius is drifting through the Atlantic between West Africa and the Canary Islands, carrying 150 people from 23 nations, including 17 Americans and a mostly Filipino crew. On board is a confirmed outbreak of the only known strain of hantavirus capable of spreading directly between humans. Cape Verde refused the ship, the Canary Islands rejected it. Spain's central government approved docking in Tenerife, but regional authorities pushed back immediately. The World Health Organization insists the danger to the public is low. But the people of Tenerife remember the last time officials said a disease arriving by sea was under control, and they do not want this ship anywhere near their shores. 5 weeks ago, the Hondius departed Argentina for an Antarctic expedition. Now 150 people remain trapped at sea while governments argue over a simple question nobody wants to answer: where do they go? Since Saturday, I've tracked WHO briefings, Spanish government statements, cruise operator updates, and port authority records. This situation is evolving faster than officials can react. Here's what is confirmed at the time of this recording. The virus aboard the Hondius is Hantavirus. Most people have never heard of it, but it isn't new. Hantaviruses are carried by rodents and usually infect humans through contaminated urine, droppings, or saliva. Transmission ends there. You catch it from rodents, not from other people. Symptoms include fever, exhaustion, muscle pain, and in severe cases, hemorrhagic fever or pulmonary syndrome, where the lungs begin filling with fluid. Some hantavirus strains have mortality rates exceeding 30%. Still, infections are rare, and most strains are not easily transmissible. They are not airborne like influenza or COVID-19. The WHO has repeated this in every briefing related to the Hondius. This is not another COVID scenario, but the specific strain found on board changes everything. The outbreak involves the Andes strain, found in South America. It remains the only hantavirus strain on Earth ever confirmed to spread directly from one human to another. Human-to-human transmission is still extremely uncommon. It usually requires prolonged close contact, sharing cabins, caring for patients, living in confined spaces. Exactly the type of environment found aboard a cruise ship. Scientists say the public risk is low. The problem is that science and public fear are speaking two entirely different languages. Every government deciding whether to accept the Hondius is doing so with COVID still fresh in memory, not as a medical comparison, but as trauma. The last time authorities claimed the risk was minimal, countries paid for it with lockdowns, collapsing tourism, and overwhelmed hospitals. That memory, more than the virus itself, is what keeps the Hondius stranded at sea. April 1st, 2026, Ushuaia, Argentina. The Dutch-flagged expedition vessel MV Hondius departed the southernmost city on Earth carrying 147 people, 88 passengers and 59 crew members from 23 countries. The route included Antarctica and isolated South Atlantic islands. Argentine authorities reported no symptoms among passengers or crew before departure. Among those on board was a Dutch couple in their late 60s. They had spent 4 months traveling across South America through Chile, Uruguay, and Argentina before boarding the cruise. Investigators now believe the couple likely contracted the Andes strain while birdwatching near Ushuaia, possibly close to a landfill contaminated by infected rodent droppings. Hantavirus incubation can last between 1 and 5 weeks. If exposure occurred near the end of their road trip, the timeline matches perfectly. They showed no symptoms when boarding, no symptoms when the ship departed. But by the time illness appeared, the Hondius was already deep in the South Atlantic, thousands of kilometers from major medical care. One birdwatching walk near a landfill, one cruise ship heading into open ocean. That became the starting point of an international crisis involving at least 7 countries. On April 11th, 10 days after departure, a 70-year-old Dutch passenger died aboard the Hondius. At the time, the ship remained far from any advanced medical facility. The cause of death was not immediately confirmed. The ship continued north instead of turning back. 13 days later, the body was finally brought ashore at the remote British territory of St. Helena in the middle of the South Atlantic. His wife left the ship with him. She was already ill. Despite this, no quarantine measures were imposed at St. Helena, no passengers were tested. The ship resupplied and continued sailing north. The 69-year-old woman later boarded a commercial Airlink flight to Johannesburg carrying 82 passengers and 6 crew members while attempting to return to the Netherlands. At Johannesburg Airport, she collapsed before boarding a KLM flight to Amsterdam. She was removed before takeoff, hospitalized in South Africa, and later died. Tests confirmed the Andes strain of hantavirus. South African authorities immediately launched contact tracing operations involving dozens of international passengers. KLM alerted everyone aboard the Amsterdam-bound flight she almost boarded. France also identified one passenger exposed during transit and placed him under medical observation. In less than 1 month, a single birdwatching trip in Outbreak triggered contact tracing operations across 3 continents. Meanwhile, the Hondius continued north. At Ascension Island, another passenger, a British national, became critically ill. He was evacuated to South Africa and admitted to intensive care. He also tested positive for the Andes strain. The Hondius departed Ascension Island on April 27th and kept moving toward Africa. Then, on May 2nd, a German woman died on board, the third death linked to the outbreak. Her official cause of death remains under investigation. However, WHO officials reported symptoms consistent with Hantavirus, including fever and pneumonia. On May 3rd, the Hondius reached Praia, Cape Verde. Health officials initially boarded the ship and delivered medical supplies while authorities prepared an isolation zone on shore. Then Cape Verde refused entry. The country said its limited healthcare infrastructure and tourism-dependent economy could not manage the operation required. The ship remained anchored offshore. 150 people sat within sight of land while the land itself said no. On May 6th, the WHO and the cruise operator announced a new plan. The Hondius would sail to Tenerife in the Canary Islands. Spain's health minister Monica Garcia confirmed the arrangement publicly in Madrid. Passengers without symptoms would eventually be repatriated beginning May 11th. Then the Canary Islands government rejected the decision. Regional President Fernando Clavijo argued authorities lacked enough information to guarantee public safety. Residents backed him immediately. Reporters repeatedly heard the same word from locals: COVID. Not the virus itself. The memory of lockdowns, overwhelmed island hospitals, and economic collapse that nearly destroyed tourism across the archipelago. For many residents, refusing the ship was not cruelty. It was a reaction shaped by the scars of a pandemic that ended less than 4 years ago. Spain's central government overruled regional objections. Madrid confirmed the Hondius would still be received in Tenerife. On May 6th, 3 people were evacuated from the ship by air ambulance, 2 symptomatic crew members and 1 close contact. 1 evacuation aircraft was forced into an emergency landing in Gran Canaria after medical equipment malfunctioned mid-flight. As this video is being recorded, the Hondius has already departed Cape Verde and continues sailing north toward Tenerife. Arrival is expected within approximately 3 days, but the real question is larger than one ship. Every port that refuses the Hondius makes the next country even more afraid to accept her. St. Helena missed its chance to quarantine the vessel. Cape Verde lacked the medical capacity. The Canary Islands feared the political consequences. Each refusal makes the outbreak appear more dangerous than health officials insist it actually is. The WHO has been clear from the beginning. Risk to the general public remains low. The Andes strain does not spread like COVID. It is not airborne in the same way and does not transmit casually without prolonged close contact. The WHO has also stated Spain has both a moral and legal obligation to assist those aboard, including several Spanish citizens currently trapped on the vessel. But governments are not listening primarily to the WHO. They are listening to voters, and voters remember what happened last time. Under maritime law, ships in distress have the right to seek refuge in port. The problem is that the Hondius exists in a legal gray zone. The vessel is seaworthy. Most passengers remain asymptomatic. Strict isolation and monitoring protocols are reportedly functioning on board. The company insists conditions remain calm, yet the ship is still sick enough that nobody wants it near their coastline. That legal ambiguity allows governments to reject the vessel without technically violating international law. This is not a wreck carrying explosives or oil, but the pattern is identical to stories this channel has documented before, something dangerous nobody wants responsibility for. One government after another deciding the safest option is making it somebody else's problem. The threat changes, the pattern never does. The MV Hondius is expected to reach Tenerife within days. Whether local authorities will comply with Madrid's orders, whether passengers will disembark safely, and whether more cases will emerge before arrival, nobody knows yet. The story is still unfolding. What we do know is this: 5 weeks ago, a ship left Argentina carrying 150 people, an Antarctic itinerary, and a virus nobody realized was on board. 3 people are now dead, the rest are still sailing. And port after port, country after country, the answer has remained exactly the same. Not here, not us. Keep moving. Somewhere tonight in the Atlantic, between Africa and the Canary Islands, 150 people are still waiting to discover which country will finally say yes.